Welcome to Learning Thursdays. As you can see in front of you, Learning Thursdays were developed as a way to offer addiction professionals a free learning opportunity with the goal of improving their knowledge, skills, and their attitudes, which equates in part to their professional development. The professional development is going to be a focus of the presentation that you'll be viewing today. As always, the goal in professional development, counseling, educational opportunities is to help improve the lives of the individuals who come to your program, be it for prevention, treatment, or recovery services. The presentation you're going to be viewing is Year of Ethics, Professional Development. So for those of you who have viewed Learning Thursdays before, you may remember that 2017 was designated as a Year of Ethics. That being said, we're not starting a whole new Year of Ethics 2018. What came to our attention was that for the Year of Ethics, we only had 11 presentations. So we would be ethically remiss if we did not finish that year and give you 12 presentations. So the one you're about to view, you can see Year of Ethics, as I alluded to earlier, professional development, and it will be presented once again by Trish Allen and Maria Passeri. That being said, Trish and Maria, thank you for joining us, and if you'd like to start from here, I will see everybody else later. Thank you.
Thank you, Patty. Again, I'd like to welcome you to the Year of Ethics, Professional Development. My name is Tricia Allen. I am an attorney with Counsel's Office at OASAS, and I'm joined by Maria Passeri. She is our BATSI Director.
Bureau of Addiction Treatment Services.
Thank you. So just a reminder, if you have any questions, please feel free to send them to learningthursday@oasas.ny.gov. So with that, I'm just going to jump right into the goals of the presentation. This is the 12th and final Year of Ethics session. And what we hope that you walk away from today is a understanding from the supervisor's perspective on how to create an environment at your program that supports professional development and staff and works towards the retention of staff within the field. We're also hoping that you will have a solid definition and understanding of that definition for professional development and why it matters in the substance use disorder field. As we work with these difficult populations, it's really tough for these individuals, the CASACs, the counselors, all the people who are in our field, and we recognize that, and we want to work to help you grow, and that's why professional development is so important. We also want you to have an understanding of why it's important to have your own individual professional development plan and have an idea of what your goals and your expectations are for your future in this field and as you progress in your career. That includes understanding what the important components of a professional development plan are, and also being aware that there is a resource and there is a committee at OASAS that we have called the Talent Management Committee that is working through workforce issues and professional development issues and has stakeholders involved, including providers. So always be aware of that and keep up to date on anything that they might be working on because it could be relevant to you. Anything to add, Maria?
Yes, there's just one more thing. I wanted to talk a little bit about the professional plan. As you know, OASAS has been rolling out the Clinical Supervision Foundations 2 training that CASACs and other clinical supervisors participate in. And during that 16-hour training, there is some specific training on how to develop a professional plan, so you will get a more in-depth view of that when you take that course.
Great, thank you. So when we talk about professional development, it's important to understand what professional development means. Some of us have gone through this already. You obtained your CASAC, so that's part of it. The academic degree or the credential and the process that you went through to get that, that's a professional development. You're learning your skill, you're learning your trade. So that's more formal, but there are also other opportunities that you can use, and we'll talk some more about some of the informal learning opportunities. There's also conferences that you could go to, you know, podcasts are an informal opportunity that I'm rather a big fan of right now. Anything that you can do to learn more about your craft. So when you talk about professional development, it's typically seen as something that's very intensive. So you're very focused on learning, you know, the facets of your profession, and it's also collaborative. So usually there's going to be an opportunity for assessment and understanding, you know, what you've learned so far and how you're applying those skills. I would note that there's no one path to professional development. There's a lot of different ways that people do it. You know, different approaches include consultation, there's coaching, there's also communities of practice, lesson study, mentoring, reflective supervision, and also technical assistance for when you're in your profession, somebody who can support you and give you kind of resources and ideas on how to work through whatever situation or issue you're grappling with. So why is professional development so important? There's many, many answers to that, but what I would say is we work in a very changing field. You know, I think we are continuing to understand what addiction means or what substance use disorder means and how it impacts everyone, how best to treat it, how to communicate well with our patients and engage them. So being up to date on all of the relevant areas of practice within the substance use disorder field, you know, it's important. It keeps you current on the standards, the expectations. It also makes it so that you have, you know, future viability. It helps you to be more relevant as the field progresses. So obviously, as part of that, you're going to you're going to enhance the knowledge and the skills that you have that you need to better serve your patients and work with the communities and with the stakeholders that you interact with in your profession. Another thing it allows you to do is to become aware of trends and help you understand or identify what's changing in your field and how you potentially could need to pivot and what skills you need to finesse or improve in order to be or maintain your place in the field. I like that this was included, so I'm going to quote it directly. If you stand still, you will get left behind. Your knowledge and your skill is your currency in the field, so if you're not relevant, it poses a risk. And the other thing I would say is we all work as a team. A multidisciplinary team is a very central focus of any treatment program, and every single member on that team contributes something to it. So the more you know and the more different connections you can make and the more development you have, the more you can offer to your teammates and the more they can offer to you. This is really important when we're working with the people we're working with. You know, they're suffering, they need help. We're there to help them. We're the subject matter experts, and the better we work as a team, the better healthcare they're gonna get.
Another thing with that also is oftentimes staff come up to me and say, you know, how come I haven't been promoted? I've been here for 10 years, or I'm the person who's been here the longest. I have the history, and I really encourage individuals to begin to take a look at the fact that just being at a program is kind of that statement about standing still, so to speak. So it's really important to begin to identify for yourself what kind of things can you learn, and what kind of things are happening in the field. And oftentimes that requires some of that individual work on your own. And it's important then to establish that for yourself in terms of a professional development plan and in collaboration with your supervisor, so that when positions become available, you're going to be the person that they're going to look to because you've done the work. And you can show the value you're going to add to the team at that next career move for yourself.
Okay, thank you. So, one issue or one aspect of professional development that I haven't really spoken to yet, but is extremely relevant to anyone with a license or any type of credential, what are the obligations that you have to continue your professional development? So this would be ethical requirements, or it could be legal requirements by statute, by regulation, or by standards and guidelines issued by your certifying or licensing agency. You know, if you're an attorney, you have continuing legal education credits. If you're a doctor, you have continuing medical education credits. If you're some other licensed individual, every license has their own licensing requirements. So I actually pulled out just a couple. The CASE Act, obviously, because counselors are very relevant in our field. There is a ethical requirement that you recognize the need for ongoing education and the maintenance of current competence. So there is an expectation and a requirement that you will continue your professional development and improve your expertise and skills. And there is also a requirement for the CPP and the CPS to observe the profession's technical and ethical standards, strive continually to improve personal competence and quality of service delivery, and to discharge professional responsibility to the best of your ability. Okay. Now, another obligation that exists, and this is from the association, or the American Nurses Association, sorry. So this I actually included because I wanted to stress the statement about a commitment to lifelong learning. I think this is universal across the fields that we're going to talk about, but I did like the phrasing of that. So it talks about the continuing education either through your own self-learning, through networking, which we're going to talk about the important points of networking and some helpful tips for it. And it could be with people you work with directly. It could be your own self-study. You could do any type of specialty certification or advanced degrees if you were interested. So there is an expectation for nurses as well that you learn new concepts, issues, concerns, and apply those in your practice. And then this is from the National Associations of Social Workers, and the value or ethical principle that we're talking about is competence, and it is the restating, similar to what nurses and CASE Acts and CPPs and CPSs have, that they continually strive to increase professional knowledge and skills and apply them in their practice. And there is an expectations that social workers will contribute to the knowledge base of the profession. So grow the profession, improve the profession by increasing your own knowledge and making it available to others. You could also look at this towards the, I guess, the ability or opportunity to mentor others. You know, as you become an expert, that professional development makes you a great opportunity for others to learn from you. So, you know, while we're talking about opportunities to increase your knowledge, you also should look at it from the lens of, you know, who can I help, who can I mentor to help them become better. Okay. So now I'm going to go through just a couple of different approaches to professional development. I mentioned them earlier. The first is the case study method. So this is a teaching approach where you present students with a case, and they kind of, I don't want to say play act, but they take on the role of decision maker and you know, describe how they would address the problem. This is a great opportunity. It's a great tool for individuals to learn how best to respond to situations. I think there can be certain situations in the field that could be curious or kind of frustrating. You know, if you're talking to a new counselor, what do you do if a client starts yelling at you? You know, so you talk through that kind of situation and how they would address it, and as they're giving their answers, you can respond and kind of help them or redirect them if they have maybe not hit on the exact solution, but it gives them an opportunity to work through it themselves.
And you know, there's a really good opportunity to do this sometimes with the incidents that occur at your facility. One particular approach is the root cause analysis. And at the ATCs, we often use this for situations that were, pretty upsetting to the staff as well as the community. And so it gives you an opportunity to kind of break it down and understand what happened and what kinds of things we can do differently. It doesn't mean that we've done anything wrong per se, but sometimes we need to take a look at different areas, and doing it within a multidisciplinary team allows you to look at different approaches.
Yep. And then another method that's available is consultation. So that's really speaking, from a role of somebody who's kind of a subject matter expert to an individual or a group, and trying to process whatever the issue is, clarify it and address it. So this would be when there's more of an immediate concern, and it offers an opportunity to have a problem-solving process, that's more collaborative. Another opportunity for education and learning and professional development is coaching. When you have someone who shows a lot of promise, but maybe there's a competency or a specific skill that they need to work on, emotional intelligence, or maybe some improvement in language or communication, then coaching could be used as a really excellent tool to try and improve those skills. And then there's communities of practice, and this is a collaborative process that's more focused on engaging in shared learning. So, it's a group of people who are kind of asking a question and learning with the hopes of getting to a common goal.
There's a special group right now in OASAS working on LGBTQ issues, and it's a very interesting community of practice where we have various providers, and we are able to take a look at what are the needs of that particular population, and how are we as programs meeting those expectations and making it a welcoming environment. So that's some kind of an example of communities of practice.
Thank you. Okay. So a little bit more about the approaches of professional development. We mentioned this before, lesson study. So this could be even self-study if you if this was the type of professional development that you wanted to take on. So this is a way that we can solve practical dilemmas. So it could be related to intervention or instruction through participation with other professionals, and then systematically examining the practice. So taking a deeper dive look at what it is that we're working with. Mentoring, we kind of mentioned this already on the previous slide, but the benefits here are it's a way for the mentor to speak to the mentee and mentee.
That's
I think
it.
I just made up that word.
No, that's correct.
To work on developing that person's own awareness, and fine-tuning their skills. And this is done by having the mentor offer some recommendations and some structured opportunities for them to look at what they're doing or how they currently offer that skill or portray that skill, and how they could maybe improve it themselves, or with the direction of the mentor. The other professional development approach is reflective supervision. So this is where the supervisor works with the supervisee, and they obviously support their staff member to have professional development. They may offer them ideas or suggestions on how best to improve their performance or grow their skills, and then they will evaluate the performance of that employee, and it could be through, maybe it's yearly or every 6-month evaluation, but some sort of way to kind of benchmark improvement or progress of the staff member. And they have to, I will note, when they are doing this evaluation, they do have to be able to clearly articulate what it is that they're seeing and their rationale for why they're assessing the staff member that way, and offering that as an opportunity for the staff member to learn. And then technical assistance, this is where we're assisting either an individual person or an organization, and it's a way to give them resources and information for a stated problem and help them understand who they can talk to or where they can go to find the information they need to be able to address the problem and change whatever it is that's potentially causing an issue. Anything to add?
No, I'm good on that.
Well, with that, then I'm going to turn it over to you.
Okay, so the importance of professional development, and I feel really strongly about professional development. And before I even get into the slide, I'd like to share with you how important it is in terms of your overall culture and program, and getting people excited about learning and feeling like they are successful in the types of skills that they're asked to do with our patients, and as well as the patients responding in a very positive way because the experience that they have is beneficial and helping them move in terms of their recovery. Mm-hmm. So it's really helpful to keep your staff staying interested and find it interesting in terms of learning different skills and abilities. And we all know that experience is a great teacher, but it doesn't mean that we don't have more to learn. And there's many new things that are happening in our field today, and there's new ways to take a look at things when it comes to advocating for services with the insurance company, providing the correct interventions so that we keep people in treatment and help them gain their recovery skills. We also want to help staff have a deeper understanding of what it means to be a professional. We want them to have a greater appreciation for the implications and how it impacts their work on a day-to-day basis. It also helps advance the body of knowledge and technology. And oftentimes when we're taking a look at the work that we do and taking a look at the outcomes associated with that, you're actually doing mini research within your program and identifying what are those things that we're doing that are successful that patients find satisfying and relevant to their recovery. And also it helps increase public confidence in the individual. We want people to feel comfortable about the work that they're doing, and as they gain those skills, they will have more competence and comfortability in dealing with the difficult issues that some of the individuals that we do see due to the complex medical, psychiatric, and also the stage of their particular substance use disorder. I'm going to go into something that's a lot more in depth, and it's known as Trans-disciplinary Foundations. And you can find the Trans-disciplinary Foundations in the TAP Counselor Competency 21, and you'll see that in the references that are noted at the end of this presentation. But I found it very important because I think that understanding this aspect of the work that we do helps us see that not only our individual experience in our own recovery is something that we have asked you in previous presentations to move away from. This helps you see what the actual definition of addiction services and counseling are related to. So let's start with first the definition, and I'm going to kind of take it verbatim. First, it's about identifying the knowledge and attitudes that underlie competence practice, not just for counselors, but for addiction specialists and other disciplines as well. And I really want to point out attitudes, because attitudes is different than knowledge. Attitudes is about the feeling or belief that we have that comes across sometimes in our behavior. So it's important to understand what it is that we do, but also it also coincides with our feelings and our beliefs about that and how they play out in terms of our behavior. Functional skills may vary across disciplines, but knowledge and attitudes highlighted in this presentation provide a basis of understanding that should be common to all addiction professionals, and that it serves as a prerequisite to the development of competency in each discipline. So, when we take a look at the first one, and that's understanding the disease of addiction, we know today that it is a disease, that it is a brain disorder. And so we need to understand how addiction affects the brain. We need to understand the models and theories that are out there related to substance use. We also need to recognize the social, political, and economic and cultural context in which addiction and substance use exists. And we know that today. We know that it's affecting the overall health and life expectancy of the population, because life expectancy is beginning to drop, which has never happened before. And so these are interesting facts, as well as how things are going to be funded in the future, how legislation either prohibits or benefits the individual from providing and getting care. It's also described in the behavioral and psychological, physical health, and social effects of psychoactive substances on the user and significant others. And so we're going beyond now just the substance use disorder. We have to be knowledgeable about mental health disorders that are co-occurring. And we also have to be cognizant of physical health, because we know individuals won't grasp substance use if they aren't feeling well or their thoughts have deviated from what is working for them in terms of overall coping. We also want to recognize the potential for substance use disorders that mimic a variety of medical and psychological disorders, and the potential for medical and psychological disorders to coexist with addiction and substance use, and really kind of talked about how important it is that we can no longer say, well, we really don't work with anybody with mental health disorders. That should not be the exception, it should be the rule, and we have to begin to learn how to work with those individuals in a very organized and comprehensive way. We also need to describe the philosophy, practices, policies, and outcomes. And when we talk about outcomes today, we are moving towards a value-based payment model and strategy. And so that particular strategy is really taking a look at what are our program outcomes. So we will have to take full responsibility and accountability for the outcomes of our program. And so we want to be able to provide counselors with the ability and the competencies of evidence-based practices that help them treat individuals with these disorders. The other thing that's very important is the family, social networks, and community systems in the treatment and recovery process. And we've learned that families are taking a more active role in the field. We have family member advocates. Those family members who've lost somebody to the disease of addiction are very focused on encouraging families to be a part of that multidisciplinary approach to treating addiction. And so we need to be cognizant of that, and we need to understand the lethality issues that are happening today with substance use disorders. We also need to understand the importance of research and outcome data and their clinical application to the clinical practice. So that is the evidence-based practices. Today we're talking about trauma-informed care. We're talking about weaving motivational interviewing in everything that we do. We know that cognitive behavioral therapy is an effective tool in making behavior change, along with all the research that we've seen on medication-assisted treatment and how important methadone, buprenorphine, and injectable naltrexone assists our patient in maintaining their recovery and abstinence from substances. And we also have to understand the value of interdisciplinary approach to addiction treatment. And you know, in today's treatment, we are now working with counsel's office. Counsel's office is developing legislative changes that have helped us bring treatment access to our patients. And those things help, like having, you know, 14 days that are prior authorization without getting approval from the insurance company. That opens doors for our patients. And so not only are we working with a variety of individuals who treat our patients, we are working with individuals that help open the road or pavement to getting increased access to treatment. In terms of application to practice, it's important that we understand diagnostic criteria for substance use. We've changed the word from substance abuse to substance use. We have found, you know, there's a change now from the DSM-4 to the DSM-5, so we're looking at things in a lot of different ways, and we have to be updated with that and using the correct diagnostic criteria when we're helping an individual get care. We also want to talk about the different helping strategies for reducing the negative effects of substance use, abuse, and dependence. And one of the things that we know is it affects sometimes personality and behavior of our patients. And that's where that attitude comes in. Because what we have to understand is oftentimes when we're seeing behavior that is problematic from our patients, that is the disease. And that is, there's something going on for the patient versus the patient's not ready for treatment. And it's that attitude and behavior that we have, or that's just drug-seeking behavior, when in fact they may be feeling some symptoms of withdrawal, and we may need to take medications to alleviate that. And so that's where the kind of the knowledge and the attitude have to come together, because the more we understand who the substance use, the individual with substance use disorder has, we are more able to handle working with individuals who may be difficult and finding different interventions that help them achieve a greater acceptance of those types of modalities. We also need to provide treatment services that are appropriate to a personal and cultural identity and the language of the client. And so it's really important why we have the communities of practice for LGBTQ, because we want that to be a welcoming environment so individuals with substance use disorders that are coming into treatment, we need to be welcoming. Every aspect of our treatment needs to be culturally competent. Additionally, we live in a multicultural world, and we have individuals in New York State who may have grown up in other countries, and we need to understand what stressors in terms of language access they have and understanding our programs, and also, you know, disabilities that may affect their ability to communicate. It might be that there's someone with FASD and they are going to need a more structured approach. There might be someone with a traumatic brain injury that requires different interventions to help that person grasp recovery. And last, On the list here is adapt practice to the range of treatment settings and modalities, and we have a large range of treatment modalities. You know, we have detox, we have inpatient rehabilitation, we are now moving towards different residential certification where we are helping the individual stabilize. We are working on the element of rehabilitation and teaching skills. And then we're also doing community reintegration and helping them get back into into a housing situation that is going to be conducive to their recovery, into work situations that also is conducive to recovery, and getting them back into life. We also want to be familiar with the medical and pharmacological resources that are out there, and we are, you know, working, as I said before, with the 3 medication-assisted treatments that I talked about, as well as others that are out there, and more research is happening with medication, addiction medications. We also want to understand the variety of insurance and health maintenance options that we have, and helping clients access those benefits. And oftentimes it's the counselor's competence in terms of how we articulate medical necessity that continue to open doors for patients getting treatment. Our language has to be consistent and with the types of language that insurance companies use. And so therefore, we could have 2 different people call for the same patient. One could get another week of services and other could get denied. Mm-hmm. So it is important to understand what is the language that we're using to help individuals access care. We also recognize that crisis may indicate an underlying substance use disorder and may be the window of opportunity for change. And this often happens with our family advocates that are out there. They're looking to get someone into treatment at the moment the patient is feeling they're ready to access care. And so how are we handling those emergency admissions? You know, we aren't no longer, and we do still get packets of information and reviewing information for individuals before we accept them into treatment. But oftentimes now we have so-and-so who we found overdosed and just came out of the emergency room last night and is ready for treatment today. And so how can we access treatment quickly? What do we need to do to be able to open that door without waiting for that huge referral packet that oftentimes just makes the process of getting into treatment cumbersome? We also need to understand the need for the use of methods for measuring treatment outcome. And outcome is going to be something that is so important with value-based strategies, value-based payments. We have to demonstrate good outcomes, and we have to demonstrate that individuals are linking to care and that hopefully are reducing the recidivism back to the same levels of care. And also taking a look at addiction as a chronic disease and just discharging somebody for use. What other strategies could we use? How can we maintain people? How can we make that the teachable moment to help somebody understand what happened and how it applies to them so that they can learn from relapses? So we want to take a look at all those different things that we do that are different than we maybe did 10 years ago.
So I just want to break in because there's 2 things that I wanted to add. The first, when you were talking about understanding the variety of insurance and health maintenance options, what I would add to that is understanding what mechanisms and opportunities are out there. You know, you talked about having the clinical language and making sure that the language that they're using is consistent with what the insurance company is using, and it really does make a difference. We've seen it every day. We see it, but it's not just about that. It's also about talking with the client and being able to understand and portray or convey to them what options are available to them, what mechanisms are available to them in the event that they don't get coverage. What are their opportunities to fight that? How can they work with you to fight that? And make use of the appeals processes or other mechanisms that are in the law or in guidance that they can use to ensure that they're getting the treatment that they want. So that's the first thing I wanted to say. The second part was, as we've talked through all of this, I think one of the things that I've realized and we're all seeing is change. We have to be able to pivot, and obviously that's why this is so important.
Exactly.
Learning more about your craft, learning more about the field. We know the field is changing, we know the disease is changing, and we know that we need to help these people, and we have to change and we have to be able to pivot to do that right. So I just really wanted to stress that.
Okay, thank you. The last foundation we're going to talk about in this presentation is professional readiness. And I've kind of talked a little bit about it as I've explained the previous foundations. One, understanding diverse cultures, what we talked about, and understanding the importance of self-awareness in one's personal, professional, and cultural life. And so we need to begin to take a look at within. It's important that when we talk about professional development, we look at ourselves in terms of what is it that, where are we at in this? What is it that we have to learn? And as I said before, some of it is going to be that you're going to take the initiative on your own to say, I need this. This is something that's important to me, and I'm finding that I'm not ready for it yet. And so that self-awareness is really important. Also, understanding the addictions professional's obligation to adhere to ethical and behavioral standards of conduct in the helping relationship. And we've done this entire series to take a look at how important it is, and this is where the attitudes come in again. So if we have attitudes that are not reflective of understanding the individual coming into treatment who has a substance use disorder, then oftentimes our behaviors then can be misconstrued as and construed as, I should say, conduct problems. Also, understanding the importance of ongoing supervision, and we had a whole session devoted for that. It is the expectation you should get supervision, and just because you talk to your supervisor every day, that is not what we're talking about when we talk about professional development and clinical supervision. And that's also addressed in the clinical foundations training. We also need to understand the addiction professionals participating in prevention as well as treatment. And with the advocates out there, and we're providing a lot of education that helps individuals see how important treatment and recovery can be. And then understanding and applying specific policies and procedures in handling crisis or dangerous situations. And that's including safety measures for clients and staff. And that's very, very important. And in today's world, we have to be taking a look at how we're bringing our patients in, what kind of search policies do we have we done emergency drills to take a look at handling situations first on the tabletop or role-playing before they actually happen in your program. And we're all talking about, putting together active shooter drills. So we know that could happen at any time, and so we know how important it is to be prepared and ready for emergency situations. We're also taking a look at creating the professional development plan, and these are important questions you need to think about in terms of having that self-awareness and asking yourself, How is the mission of your organization changing? What are some other changes occurring regarding our customers, our services, our work processes, our organizational structure, reporting relationships? You know, I know when we first started out, we only had 1 or 2 people in our admissions department. Now we have a team. That's changed dramatically because a lot of work has to happen in the beginning with all the changes with insurance companies. What is the organization's changing needs regarding the workforce? What are they expecting us to understand? What opportunities are available to develop new expertise and skill? There are a lot of trainings out there. Many are free. Take advantage of that. And it's also important as supervisors to identify that this is an opportunity for providing your staff with some important learning and also a day away from the office. We talked about that in counselor wellness as well. You know, how can we add opportunities within the work setting? Who can come in and do trainings? Sometimes we rotate trainings amongst each of the staff members where they prepare something and then present it to the rest of the team. Going to professional conferences and mentoring, and we'll talk a little bit about mentoring later. And how might your role change in the organization? How can you be prepared to develop new skills for these changes? And how can you use your strengths to your advantage as well as the organizational advantage? Some more to think about in terms of professional development plans is understanding what appeals to you. There may be some areas that your organization is moving towards that are of great interest to you. The best way to do development is to pick an area that piques your interest. For our organization, we're going to eventually move towards telepractice, and that's been an exciting, we've been talking about it, so that's been a piece that in terms of questions and answers from staff and helping them find resources to further that goal in the organization. What areas of strengths, interests, and personal plans overlap with the changing needs of your organizations? Some organizations have merged recently, so they've become bigger. And so asking the question, listening to what's happening at the executive level or the management level, and finding out how the strategic plan is being implemented over the next few years. What knowledge, skills, and abilities are important for you to increase? We know how important evidence-based practices are, and sometimes people say they know what they are, but how are they actually implemented? And what opportunities will help prepare you for the future? And that's where we're moving from that standing still to taking a look at all the different jargon that's out there, working with health homes, understanding the goals of DSRIP, and moving with those two new strategies through the value-based payment model. So taking a look at a professional development tool, there's a lot that's out there. And when you do take, and what we will hopefully try to get to you is the actual plan itself, so that you could take a look at all the different components. We also want to share with you how important networking is. Networking is really helpful in understanding and talking to other people in the field. And that's one of the benefits of going to conferences, is that you get an opportunity to talk to other people in the field, and that helps you identify maybe something that you would like to pursue in terms of your plan. It's also a network. Networking is also, you know, an art and a science. It certainly requires you to be very open, honest, articulate. And sometimes that's hard for individuals who tend to be quieter and shy, but that doesn't mean that you can't learn that skill and you can't learn to introduce yourself to someone else and begin to develop a connection with someone who may be able to help you. So these are some of the things you can do, and we've kind of talked a little bit about things throughout this presentation, but you could take a class. You can teach yourself a skill. One of the things that I learned extensively by doing the ethics training is becoming the ethics expert for our programs at the addiction treatment centers.
Content development.
Exactly.
Being on a camera.
Exactly. Volunteering, deciding that volunteering for a moment and gaining some skills helps you see a different perspective. There's a lot online as well, so taking a look at some online tools. And oftentimes you'll see, once you have a topic and you Google it, you'll see all kinds of things that come up. So that helps you take a look at a particular topic in a very comprehensive way. Seeking out people who are on the career path you aspire to. It's always good to listen to people who you would like to be, or even who you just admire, to take a look at how do they present the goals of the organization. I love to listen to CEOs talk. I find them very interesting, and I like to see how they lay out a plan for their companies. So these are things you can do just as a passive learner. Shadow a colleague, find a mentor, read. I can't emphasize enough how important reading is. What I do with the assistant or the directors and the assistant directors of the addiction treatment centers is I have a book club, and now we're on book 3. 2 have been about leadership, and the 3rd book is Toyota Kata, which is about organizational change. So we're actually taking a look at a car company and applying it to addiction treatment services in making positive change to help an organization from the within solidify their business processes. Attend a conference, and don't neglect your soft skills, and I mean that through leadership, interpersonal skills, talking in front of a camera. Those are all the different types of soft skills that are sometimes required of us on the job. Mentorship is a great opportunity. And one thing that separates mentorship from other supervision is the fact that it's usually a non-reporting environment, non-reporting person, I apologize. And it's a person you could go to kind of talk about your needs, and they will give you the perspective from their position. Oftentimes it's a position that is at a higher level than you, and that you're learning to gain those skills and abilities through different types of things, such as assignments, instruction, on-the-job training, those types of things. So here you can see the difference between coaching and mentoring. Coaching being that you may be the manager, the clinical supervisor, the colleague, so someone who's more intimately involved with you. You're getting expertise in a required area, like oral presentations. That's for an example. So it always focuses on a particular topic or behavior that you would like to learn. And then coaching also provides lots of feedback. And if you think of football, the coach is encouraging the team and encouraging the team to do their best. And so that is the role of the coach. Mentoring is a non-reporting relationship, as I said. so the individual has a broader range of knowledge, and it's about what an agenda from the mentee and the mentor. And so both mentors and mentees can participate in mutual sharing and reflection. So the principal areas of coaching and mentorship really involve relationships, a relationship between the coach and the person, and the mentor and the mentee, providing that sort of expertise or competence that someone's learning to get, focus, direction, and most importantly, feedback. And we've got to be able to accept feedback in order to make growth. And most of the growth that anyone learns is through mistakes, not through successes. Mm-hmm. The benefits of a mentorship allows greater clarity for life and career choices. It might be the ability to maintain your work skills and abilities while also establishing a family. So those are things that could be involved with mentorship. Also, new insight on company culture and organization, so that's big picture type values. Opportunities to develop networks and develop contacts. Also, access to new resources, greater career satisfaction, and the likelihood of career success. And that's a really good point, because when we're satisfied, we have a lot of success because we're gaining competence and confidence in what we're doing. And development in areas that are not typically addressed through training or on the job. And that oftentimes is leadership, the way to speak in front of others. Those are things that aren't necessarily taught in a particular conference or training. The other thing that I wanted to share with all of you were some 7 tips for successful networking. I think networking is very, very important, and it does require a lot of skill. And so I wanted to lay this out for you, because this is something that's going to come from you. And so this initiative from you can make it very successful. So the first one is peer learning. So we have to learn how to improve our observing others around us. And at OASAS, we have a lot of opportunity to observe all different disciplines. And so you need to look at your organization and say, how can I learn from this person? What can I do to just listen? You must always be ready, engaging in dialogue with new people. So it needs to be on your feet, and you need to be quick. Yesterday, I was at the ATOD conference where there were thousands of people, and someone got up and talked about services in New York City. And she said, so if you're from New York City, come and talk to me. So that was my opportunity. Mm-hmm. That was my cue to get up and meet with her. So, clearly I had to jump up when the workshop was over and flag her down and have a conversation. So we took some notes, we exchanged business cards, and we asked a lot of questions in the brief moment that we were there together. We can move on. We also talked about ourselves. And so I briefly talked about the addiction treatment centers, but I had to also be very careful not to engage too long on my topics, because it's really a mutual sharing when it's networking. So we have to be careful that we're not talking too much about ourselves and that we are asking questions. So while that's happening, the other thing you want to make sure is you have to hold yourself accountable. And finally, it's follow up, follow up, follow up. So now I have the business card. I have to send her an email and say, thank you very much for talking to me. I'm really hoping that we can share ideas so that there can be better collaboration with my services as well as yours. And that really makes for successful networking. OASAS's Talent Management Committee has been around since 2007. We want to be the profession of choice. The committee develops recommendations and strategies to implement actions that will have a positive impact on the multitude of issues and challenges facing our leaders, managers, supervisors, and line staff that comprise the New York State substance use disorder workforce. And that means salaries, retaining good employees, and understanding when employees are not fit for the job, that we have a professional and ethical way we make changes to individuals' behaviors. We want to engage employees clearly. That is very, very important. And providing that professional development is a way to engage employees. People get excited when they're learning and gaining new skills and abilities, and learning how to foster business relationships, personal, professional growth, job satisfaction, and improve service outcomes. When you're happy on the job, you will have better outcomes. Leadership development, the capacity to listen and observe at all levels is very, very important. And that's why I use the book method, a book study method with our directors, because I feel leadership is extremely important if we are going to help our programs serve our patients in the best way we possibly can. Board development. Many of your programs have boards, and we want to also engage the board and making sure that they understand how to effectively carry out their governance responsibilities. And employee and clinical supervision, which we've talked about throughout the 12 sessions that we've had here. This relationship is evaluative, it extends over time, it enhances the professional functioning of the supervisee while monitoring the quality of services offered. And quality is what we're about. They also take a look at healthy organizational culture. We want a productive culture. We want a healthy culture. So we want an organization that is respecting culture, fairness and open communication, so that we understand what is the company's values, what are their norms and behaviors. And we know some companies out there are best companies to work for. And so those healthy organizations have found the key to getting employee satisfaction and quality outcomes. And cultural competence, which is very, very important today. Understanding who we're servicing, the type of families they are, the communities that they come from. We need to be able to practice our clinical skills and approaches, policies and strategies that match the service population and enhance the quality of service as well. Professional ethics, we can't do anything without that, and with the Justice Center, this has been a great addition to our field and helping us focus in on conduct that goes beyond what our expectations are in terms of providing ethical care to our patients. And career development, which is very, very important. The strategies by which an organization provides and manages learning opportunities, professional development and growth, and career advancement of its members. In summary, what are you willing to do to increase your professional development? As a supervisor, are you encouraging and facilitating professional development for the staff that you supervise? And what best practices and strategies do you have to promote professional development for all staff at your program? Next is the list of references that we utilized. It's really important to take a look at TAP 21. It may be out of, they may be out of supply of that, but you can download it. So it's very, very important. And I want to thank you very much, and I want to thank Tricia.
Yes, thank you. This was a great experience.
Yes, it has been.
Thanks for joining us for all of our sessions. If you haven't seen the other ones, please feel free to look on the Learning and Development Unit website for Learning Thursdays for the prior sessions. Thank you. And our contact information is shown here. Feel free to send us an email if you have questions, or the Learning and Development email box as well. Thank you.
Thank you.
All right, well, Maria and Trish, I would like to thank you for coming out of like Learning Thursdays hiatus, if you will, and coming back to make sure that the 12th segment was taped and ready to go. For those of you who have viewed this, we look for your feedback. It is appreciated. If you have a moment, if you could just follow the link to the SurveyMonkey, let us know what you thought about this particular presentation. As always, we thank you for joining us. We thank our presenters for their time and their experience, and we always thank Media Services for making sure that the product you view is of the high professional quality. I will see you all again. Thank you, and bye now.